and you're not supposed to talk about how much you're being paid or how much the clinic is being charged. It's all written into your contract. You're not supposed to be talking about it. And I was at this particular locum gig. It was in a rural country hospital, completely being held together by locums. We were all locums from all over Australia. And, people start talking in the tea room. And the disparity amongst our hourly pay was quite extraordinary for starters. I thought, how are we all doing an important job? All of us were experienced in this particular group that I was discussing it with, and yet we're all on vastly different hourly rates. And therefore, the hospital is being charged a rate on top of that per hour. It didn't sit well with me. I thought, surely administrating me here hour by hour is not worth my wage again per hour. And that's Medicare money.
Welcome to the Optimised Practice Podcast. I'm your host, Jono Heath, and today I am joined by Haley Uden. And Haley's got a bit of a different story to a lot of the people who come on this podcast because she has had a very varied career path in podiatry, and not necessarily one that I think a lot of people have experienced. So it'd be really interesting to dig back into that. So Haley, I wonder if we could just take you back to why you started in podiatry. What was it that attracted you to that particular profession to start off with?
Yeah, I think it's a similar story to other podiatrists. I had been to see a podiatrist when I was in my teens with a sore foot. And here in Adelaide, it was a very well-established practice and it was quite swanky for the era. They all wore suits. It was a really beautiful practice in a really prominent area of Adelaide. And I remember being a bit like, oh, this is a bit nice. At that stage, the only exposure I had was to orthotics because that's what I was there for. So orthotics and that MSK side of things. Little did I know, I remember sitting in my first lecture on a Monday morning and the lecturer was talking about ulcers. And I was like, where am I? Because I'd only heard of mouth ulcers at that stage. That's how unprepared I was, Jono, for the degree. But yes, I was introduced to it because of my own foot problems. And then I remember in year 12 thinking I didn't have the grades to be a doctor. I didn't want to be a nurse. I wasn't really interested in OT. And I didn't at the stage have the marks for physio either. So it was almost like a little elimination. I knew I wanted to do something in medicine or that medical field. And so, yeah, I still see that colleague to this day. Shout out to Sean Murphy. He's actually probably turned quite a few people into podiatrists. But yeah, and I'm pretty lucky, I think, at the end of the day that I ended up enjoying it because I knew really in retrospect very little when I logged into the degree. But here I am, 21 years later, still here.
Did you stay as an employed podiatrist in a private practice for a long time?
Myself? Yeah, so my first couple of years out, I did private practice, grew a little bit restless, wasn't quite what I thought it would be. It was a very general aged care type practice. I grew restless and I thought I'll pack my bags and move somewhere. So I moved to Mildura in rural Victoria. And I ended up working in a community health service and I had a ball. Being one of those rural positions, you get a bit of everything, don't you? And I actually saw a really high paediatric caseload just by chance because the senior pod wasn't really interested in peds, so it all fell on me. Fast forward another 5 years, I ended up at UniSA covering a maternity leave of someone who taught paediatrics. And they took me on because of my paediatric experience. So it just sort of, the way things happen. And yeah, so then I was in academia after private practice and community service. I did academia for 10 years whilst working clinically on the side. And then I thought, you know what, maybe I should go buy a practice, Jono. Let's get into private practice again. So I left academia.
Tell me about that. What was that spark that you thought, private practice might be something after, this is about 15 years in, right?
Yeah. I thought it would buy me some freedom and good income and have an asset, really, was where we were looking at with our family at that stage. We thought, let's have an asset. It was rocky. I'm not going to lie. We started from scratch in a bricks and mortar standalone practice. in 2019. So we were a year in when we got hit with COVID. I had no idea what I was doing. I barely got going and then smack bang into a pandemic. So it was a really quick, rocky experience for me. I lasted 5 years, or 4 and a bit years, and we sold the practice because of all the things that all of your practice owners know. I'm really grateful for the experience, but it did kind of chew me up and spit me out the other side. Without that experience, though, I wouldn't be doing what I'm doing now, because the learned experience of how hard it can be in private practice and my empathy for practice owners grew because of that experience.
Some of those struggles that stand out for you are some of the toughest things that you think you were facing. Can you talk to me a little bit about those?
Absolutely. I mean, no one prepared. Well, you can do courses, of course. I wasn't prepared to be a boss and a leader of sorts. That was a learning situation for me when you first start employing. Employment was a constant battle. I was there 6 days a week already as a practitioner, already juggling. And then your staff member would call in sick. And there's only so far I can spread myself. We were a 2-room practice. So the constant ups and downs of staffing really killed me towards the end. I remember the turning point for me, Jono, I remember it so clearly. It was a day off. I didn't have to be in the clinic. And I was in Bunnings with my 3 children, which, you know, is a journey on itself when you have little people, those silly little trolleys. I had 2 kids running around with those 2 trolleys. I had one being, you know, she was off doing what she was doing. And I was trying to field a call from my receptionist at the front desk, who once again was asking me how to do a Medicare claim. And I just remember standing there with my kids bumping into each other, you know, terrorizing poor people shopping, thinking, what am I doing? This is not what it was supposed to be like. And I just thought, I can't keep doing this. We did some business coaching, which really helped. I thoroughly learned a lot, but I think by the time that I did that, I was already burnt out, to be quite honest. I was exhausted. I wasn't really well, and my zest had died. I just couldn't pick myself back up again. It was time to be done. You know, often in times when you're hitting a low, you can really rally and keep going. I'd gotten to that point where the thought of going into the practice, I was dreading it. I'd walk through that door and just think, God, what now? Every time my phone beeped or rang, I was like, what now? You know, that feeling of dread had just sort of taken over. So unfortunately, I probably just wasn't in the right mindset to really push on. All pressures that everyone knows. I just think at the time of life that I was at, with 3 small children as well, it was just it just wasn't working. Yeah.
So something had to change, obviously.
Big
So
time.
tell me what happened. What happened then?
Well, we sold the practice. I took a bit of time to calm down a bit. It took a while for my nervous system, honestly, to regulate down a little bit for a while. And I did some locuming. I thought, I'm just going to take some shifts around the place just so I'm still working without stressing myself out. And so I started doing some locum shifts in Adelaide. And I'd always held a casual position tutoring at the uni, so I continued just doing that with the uni students. And then I did one particular locum stint that really, it's put me on the path I'm on now, because I just thought, wow, we could be doing this better in terms of how locuming is organised in the allied health industry. And there was a couple of experiences that irked me, to be honest, Jono. Having that experience of being a business owner, and honest to God, it just felt like your hand's just in your pocket. Who wants money now? You just feel like, what bill am I paying now? What subscription? There's just so many costs. And I was at this particular locum gig, and you're not supposed to talk about how much you're being paid or how much the clinic is being charged. It's all written into your contract. You're not supposed to be talking about it. None of it's transparent. It's all like a secret society. And I was at this particular locum gig. It was in a rural country hospital, completely being held together by locums. We were all locums from all over Australia. And, you know, people start talking in the tea room. And the disparity amongst our hourly pay was quite extraordinary, for starters. I thought, how are we all doing an important job. All of us were experienced in this particular group that I was discussing it with, and yet we're all on vastly different hourly rates. And therefore, the hospital is being charged a rate on top of that per hour. And it didn't sit well with me. I thought, surely administrating me here hour by hour is not worth my wage again per hour. And that's Medicare money. And I felt really uneasy about it. It really didn't sit ethically well with me that the hospital, because they felt like they had no choice, had to use agencies. And agencies have a wonderful place in this industry, but I feel like there's a markup because it was a hospital position. And I just felt really bad. I've got patients who are, it's high risk department. They're really up against it with their own health. Their, feet are falling off. They're in really bad chronic disease states. We can only afford to have a 2-day week service because of the cost of the locuming, or it was a 3-day service basically, because of all that additional cost. And I thought, imagine if we could just reduce those costs for clinics and at this stage the hospital, so they could actually provide more service to the people that we're supposed to be there helping, rather than just charging really astronomical administration costs, because they can. So that really got me thinking about, how can we do this better? And having been a business owner, on a couple of those days when a staff member would call in sick, we did look to have a locum for the day, but the cost was prohibitive for where we were at with our diary. Being a 2-room, there's only so much gross that you can make in a day. So it was prohibitive. It was actually better for us to shut the diary for the day so that we weren't in the red to pay someone to cover. So I thought about all these things
for a lot of practice owners, right? Because they've got to make that decision. If it's going to be a matter of losing money during the day, or like there might be some people who are actually quite acute, who really need to come in. Well, and then the practitioner's like, well, what do we do? How do we actually serve our patients? And again, this comes down a little bit, I guess, to a model situation in a small private practice, because if it is just principal or principal plus one, and let's say flu goes through or something goes through the practice, and you've got both those practitioners off at the same time, it is very, very challenging. And so you've had this experience in the private hospital. It wasn't fitting, wasn't sitting well with you. So what happened then?
I thought, you know what? I mean, I'm in healthcare, so IT is not my expertise, but I thought there's got to be software for this. There's got to be an app. There's an app for everything. Why are we not utilizing a better system for locuming as such in our industry? I sat doing some late night Googling. I could find similar platforms exist for short-term relief teaching. So a lot of school systems have it. So if you're a relief teacher, you're part of this platform and you get alerted when a shift becomes available. They exist in a lot of the private hospitals for doctors. There are quite a few doctor platforms. Nursing agencies utilize this type of software. And I thought, why aren't we doing it? Surely there's got to be a solution. So I sat doing a lot of late night Googling. I'll just scroll every now and then, and I stumbled across some software, and I thought I'll just reach out and see who they are and what's going on. And it's actually a business owner in Melbourne, and he is a software developer, and his wife's a pharmacist and owns several pharmacies. And 5 years ago, she was discussing what we're discussing, which was, I can't stay fully staffed. This is killing me. And I guess pharmacies have quite a lot of pressure because they're open usually 7 days a week. They do early to extended hours. So staffing that is huge. So they started Locum Mate, which is out of Melbourne. It's nationally throughout Australia for pharmacies, and they've been running for 5 years now. And so I discussed it with them, and here we are. We've now designed the software to meet our needs in allied health, because there is quite a few differences in the way we go about working. And so now we've created the fully automated system for locuming. The priorities of which, for me, the bits that I was really clear about, I want clinics to, where possible, pay less in fees, because clinic owners are already doing enough of that. I wanted people to be able to choose what they wanted to put the shift up for. So if you want to pay someone $50 an hour or $100 an hour, your prerogative. No one's stipulating the price as agencies do. And I wanted locums to be able to see it all transparently, because the other thing about an agency is, and once again, they make many of the locum positions around Australia work, but you can't see what's on their books. So when you send in your CV and say, look, I'm interested in work here or there, you don't see all of the jobs available. They go, oh, here's one, and it's $60 an hour. I don't know if it could be $80 an hour somewhere else. You don't really, well, there's no choice. The power's not in your hands. So I really wanted clinicians, where possible, to earn more if they can, because the administration burden's lower. And the other thing that clinic owners would be aware of is that it's like confusing. Do I pay super? Is there GST involved? Are they a sole trader? Are they registered as a company? Do I have to put them on my books? What do I do with a provider number? Like, there's a whole lot of complexity to hiring as it is, let alone hiring for a short-term fill as a casual worker. So, and there's a lot of awkward conversations that happen. When a friend rings and says, can you work for me Wednesday? And you're like, sure. How much an hour are you paying? And then you've got to quickly think, will that cover my costs by the time I pay tax? And do I have to pay myself super? It's confusing and complex. So anytime we can make things simpler for clinic owners and clinicians, I think is good, because we're under the pump. You know, you're trying to run your diary, you're trying to keep up with all the normal day-to-day, all that HR queries can be confusing. So yeah, here we are with Hey Lucy, hopefully a solution.
Well, that's right. One of the things that I'm really impressed by is that you've had this career which wouldn't necessarily indicate a real entrepreneurial spirit, because you've been in work, you've been working as an academic.
Yes.
But it seems to me like doing something like this would take a lot of courage. How do you feel in terms of, if I made that comment, look, that's actually quite an entrepreneurial step. How does that word sit with you when you think about yourself?
Well, I've learned a lot about myself over time, Jono. I remember in my first couple of jobs, I thought there was actually something quite wrong with me, because I feel restless quite often. Love my jobs, love being a podiatrist most days, like my clients, like the receptionist, I enjoy it, but I would find myself restless a lot, which is why when I was in Mildura, I did my master's because I was restless. I thought I got time up my sleeve. I guess you study. So I went back and did my master's. Then when I got into academia, there's always something to do on the side. There's a lot of side hustles. You write a paper, or you do a review, or you get to do a presentation. So there's that kind of movement. And since I've learned about myself, I'm better when there's moving environment. I get a bit stagnant quickly, which might be entrepreneurial, but I do like movement and change. So I often my husband will attest, I come up with great ideas, often not great follow through, but I feel like I'm always buzzing away with what could be done differently, or how could we change this process, or this isn't working, or what could I do next? But having said that, when you use the word entrepreneur and starting a company, we've had some really sleepless nights. There's a lot of fear and risk involved, isn't there, when you're putting money on the line? So we are in that at the moment. In any startup, there's a lot going on. The ball's rolling, money's going out. You're thinking, how are we going to sustain this? What does this mean? So at the moment, there's a lot of fear, still excitement, a lot of belief that I just always, when I connect, particularly with podiatrists, you come away from an event where you've been around your colleagues. I think, God, I really like podiatrists. We're good people. I enjoy that contact. So that keeps me going. Because, on those days where you're thinking, why am I doing this? You catch up with a few of your colleagues, or you hear how some of your friends who own clinics are struggling. A, they don't have enough staff. B, they haven't had a holiday in however long. I just think that keeps me going because I care about that. So there's a lot of fear, but there's a great lot of care factor that I hope will keep sustaining me, Jono, as I go through this, because I do care about us and allied health. I do care, and I want it to be better for us. I want it to be a more fulfilling experience where possible during this staff shortage that we're all really living in and experiencing, that it's harder to hire and recruit and retain staff. I hope we can share our workload a bit more, sharing the workforce. There's a lot of us out there still registered. I feel like we just need to mobilise us better.
Well, I think there's a lot of commonality. You've obviously been in private practice and now you're taking a shot at something which is really quite exciting. And I can hear the excitement in your voice and the similarities, I think, between anybody who's like starting out, whether they're starting out in the private healthcare practice or whether they're like you, taking the next step and jumping into something which is, quite a different model and something that you have to actually craft into its own model in itself. Whereas people who are in podiatry practice, there is a kind of a proven process, a proven model that, okay, if I get a principal just working really well, and then I get, 2 or 3 or 4 practitioners working along, it's a business model that you kind of know how to work. And in your situation, you are creating this thing where there's going to be a lot of unknowns. The thing that I got from what you were saying before, Haley, was that sense of purpose which is driving you. And I just wonder if you're thinking about your passion for podiatry, your thoughts about the profession in general, and where you'd like to see that go. Do you have any thoughts about that?
Podiatry in general, where I'd like to see us, absolutely. I would like to think that I don't like that feeling when I teach new graduates at uni, when I'm teaching the students, and they tend to be quite full of excitement. They're coming towards the end of their career, their course, they've made it, and then they're all applying for their first jobs. I just think, God, I hope we can retain you in this profession, because we know that there are things about our profession that can lead to some dropout and people changing careers or feeling a bit burnt out. So I'm hoping that with more employment opportunities, different employment opportunities, we can spark people's renewed enthusiasm. I wonder if, and this isn't just podiatry and allied health, I wonder if some of the models in which we have worked over time, as much as it was the way things were done, I wonder if they were the best way to do things. I don't know if slogging away 5 days a week is for everybody, and I think that's okay. So I'd like to think that in podiatry and allied health, there might be other models that are okay and that we might shift with time. I hope that by giving people opportunities with something like locuming, that there are opportunities to work when you want, for what you want, and where you want. So if you only want to work 2 days a week but want to maximize your income on those 2 days, locuming could be an option. If you want to travel and work, this gives you that opportunity to go help some practices in Queensland during summer, or in Adelaide's winter, go to Queensland and have a really nice time. Traveling for work is an option with a platform like ours or with this solution. So we might get a few more people staying and rejuvenate that interest, because you get to go out and meet more colleagues, see new things, see how things are done differently, adopt new practices. So I hope that becomes more available to people. I hope our small to medium-sized business owners hang in there, because I was talking about this on another podcast, other software developers. Without that level of business, we don't really have a profession. Because when you leave uni, majority of us go to private practice. There's only so many public positions available. They're somewhat capped. And then the rest of us flood into private practice. So without these trailblazers who are taking, I would arguably suggest, most of the stress of our profession by being a business owner and a practitioner, we don't really have a profession. So I hope that we can support them better, because if staffing is one of, I think it's the bit that I hear about the most, if staffing and lack of it is really hurting and driving people out and exhausting our clinic owners, then I hope we can support them, because if they've got more staff and they can have those couple of days off to work on their practice and do the other things or be with their family, I think that's really important as well. So that's what I hope is going to happen.
We have a lot of private practice owners listening, and if they're choosing a locum, from your point of view as having been in that position as a locum, what do you think private practice owners need to do to make the locuming experience as good as possible?
For sure. I mean, I've had some good experiences, some in-between experiences. Ideally, if there's any orientation, that is helpful. I always say if your first patient's at 9 o'clock, you want to start the shift at about 8:30. Give them some wearing in time. What's in this drawer? Where are things that I need? What's in that cupboard? What's the admin support person's name? I'm using Prac Suite today. Look, everybody has this trouble. And look, I'm not blaming anyone, but usually logins don't work. Like, the login and the password is always, I don't know why IT does that, but there's often a little hiccup there with setting up a profile for that person for the day. I think just being helpful and welcoming, because you need to understand there's going to be some things they're not going to do exactly the way that you need them done or what you were expecting them to be done, but being open and honest about that. I think there's probably more onus on a locum to be open-minded, communicative, really respectful of the way that practice goes about their business. There'll be nothing worse than having someone come in and stirring the pot or making things awkward for the day. So I think there's more onus actually on the locum to go in with a very respectful mindset that I'm here to work in your blood, sweat and tears and your asset for the day. I'm going to do that in the best way possible. I know that feeling of building up your practice and retaining patients, and that horrible feeling, what if I have a practitioner who's scaring them away? That's, so I think there's almost a little bit more onus on the locum, I think, to be the best version of themselves going in and being very respectful of the space, to speak well of the space and the practitioners. I think with all the systems that we have now, I did a shift on Wednesday at a practice, never been there before. I had my time in the morning to adjust, and the admin support was wonderful. He gave me a tour where everything was. I had time to set up my space the way I kind of need it to run. And then Teams was on, so I could contact the staff member, the owner, throughout the day just via Teams. It was super easy. So I think there's lots of software that you can use to make that communication really easy. I didn't have to jump on the phone. I could just throw in a quick message, and they were messaging me during the day asking for a few things. So yeah, orientation and just being there somewhere, even if it's behind a computer, you just know that there's someone, or it could be the practice manager. You've always got someone to hit up if something's not going quite right.
So it's kind of like, I know we're very big on the importance of that onboarding and induction process for a longer term employee.
Yes.
But it sounds like if you can have really good systems developed, good communication channels, whether it's Slack or whether it's Teams or something of the equivalent, so that those are open and easy, and to just make everything easy to find, then it's pretty much the elements of having a really good private practice will be the thing that makes
Absolutely.
it a good experience for the locum coming in, so that you can hopefully get a good review. Do you
Absolutely.
have a reviewing system on Hey Lucy?
We do. It's a very quick one. We don't get too invasive, and it's not publicly facing. It's mainly there so that we can see if anything's going a little bit pear-shaped in the background. One day there might be a public-facing version, but I didn't want, experiences are so subjective. I thought we really only need to touch base if there's been something problematic, because personality clashes happen. I think this is a good practice versus a bad practice. We touch base on communication and overall experience, but we don't get too invasive yet. We'll work out our value. I didn't want it to be like Uber where you're rating clinics, put it that way, or rating locums. I mean, you don't, I didn't want it to get to that point because that's a very subjective experience. So we won't be rating anybody and putting up their stars for people to see. It was mainly just to track if there was any problems we need to help avert if someone's had a particularly poor experience for a certain reason. Yeah, no stars is not quite like a dating app just yet. You don't have to swipe left or right just yet, but they'll keep making sure people have hopefully a positive experience, and if there's problems, we help mitigate them. I think as well, like I got to the clinic and I was quite impressed. I had a really good coffee machine, Jono. That ticks one of my boxes. There was a kitchen, there was some biscuits and a good coffee machine, and I was set for the day.
Well, there you go. Anybody listening, the most important thing about your practice setup is
Beverage.
not the Swift or the Zebrus or whatever. It is actually the coffee machine.
Yeah, good
All
beverages.
very exciting, Haley. Where, if people want to find out a little bit more or investigate a little bit more about Hey Lucy, where can they find out about that?
Absolutely. So we are on Instagram and Facebook and LinkedIn. So you can look for Hey Lucy, HeyLucy. You can also download the app directly from the App Store and for Android users from their store as well. You also have the web browser version as well. Importantly, if you want to give us a try, there's no cost to download our app. So you can put up your profile as a locum, thinking I might look for some work, or as a clinic, and there's no cost involved. So you can go through that little onboarding phase and do your profile, and there's no cost. So you don't have to feel like I have to subscribe to anything and you're not putting your credit card in at any time. So give us a try and just have a look around. There's no financial risk. Yeah, and also I think on my LinkedIn we have our support email, which I cover as well. So you can also follow me from my name as well, from my full name there on Facebook or in LinkedIn as well. So we're in all the channels.
Well, thank you very much, Haley Uden. That's your experience from Hey Lucy, and that is an interesting thing. If you're listening to this and you think I'd be quite interested in having a look, I'd encourage you to go and just check it out and see if you think that might be something. We know that in this particular time, I know I'm always pretty hard on people complaining about external forces which you can't control, but it is a reality, particularly in regional areas, that there aren't enough practitioners to actually fill the roles that are available. And that's across Australia, New Zealand, the UK. So thanks for listening to this episode of the Optimised Practice Podcast. Thanks very much for joining us, Haley. And if you would like more help with building a profitable private practice that doesn't rely so much on you, then check out the Hive Practice on all the socials, and we'll see you next episode.